Now to the fight over abortion. 2 years to the day after the Supreme Court ended the constitutional right to it. In Kentucky, a law instantly went into effect, banning the procedure completely. Today, a group of doctors, lawyers, and medical students came together to share the impacts of the ban on the medical profession, saying fewer medical students are choosing to work here because of it. On this day 2 years ago, the U.S. Supreme Court ruled to overturn the constitutional right to abortion. In Kentucky, a law automatically went into effect that day, eliminating all abortion access.
It is wrong, it is extreme, and it is cruel. And I didn't think we'd still be here 2 years later, but here we are.
Today, pro-choice advocates say the law's impact extends beyond abortion access, influencing the way doctors can help their patients. UofL OB/GYN resident Dr. Kaylin Samuel describing a regular occurrence for her. A race against time to get paperwork done ahead of what are sometimes emergency operations.
Even to the point where we're having to fill this paperwork out before we're able to provide care to them, which has halted their care and definitely caused harm even to our patients.
One of the biggest concerns is the future of Kentucky's medical field. Multiple pro-choice groups describing what they call a concerning consequence of the abortion ban. Fewer medical students choosing to study in the state and doctors deciding to work elsewhere.
We've already lost 15% of our doctors. 25% of the doctors we've lost in Kentucky in the last 2 years are OB/GYNs. This is going to have ripple effects for a long time unless we fix it now.
In response, the Kentucky Reproductive Freedom Fund is launching a new statewide campaign, putting billboards like these in Kentucky's rural areas and mobile billboards in cities like Lexington, Frankfort, and Bowling Green. Meanwhile, Kentucky Right for Life Director Adia Wushner calls Kentucky's abortion ban a commitment to protecting preborn Kentuckians, and she says 2 years later, the mission is holding strong.
That is protecting lives. It's ensuring that mothers who may have health care issues we want them to be seen, appropriately. But it's also protecting the lives of Kentucky's most vulnerable citizens, and that is preborn Kentuckians.